to another edition of Emil and Amok's Takeout. We're very pleased to be joined by the doctor who is the face of the NHPI, of the AANHPI, at least when it comes to COVID. He's Dr. Reno Samoa, and he's there in the Los Angeles area at City of Hope. Dr. Samoa, thank you very much for being part of the Emil and Amok's Takeout.
Thank you so much for having me. It's very nice for you to give us the time.
Well, it's important because every time we have an Asian Pacific American Heritage Month, we get the AA part, and we fit in a few Filipinos. Sometimes we forget that there's the NH and the PI, and we step back and say, what's that big lump under the carpet, as I've been saying for the last 25 years. And now we have people who say, okay, the P in Asian Pacific American, that's the AA or the NHPI. And some people say, no, we are the NHPI, and now we're just one big bunch. And when it comes to a major story, I just want to talk to people who have the NHPI story, and you have it when it comes to COVID. And so, first of all, before we get to it, that's a little tease to get to your story. Tell me about your story, Dr. Samoa, about how you became a doctor, your origination story as a NHPI guy. Born here or where?
So I think I should clarify, when I speak about data, I will use the term Native Hawaiian Pacific Islander, because those are the designated federal terms for our group. But when I speak about my people in a community setting, or if I'm referring to my people, I will only use Pacific Islanders because that's the unifying term that we fall under. And so I am...
Thanks for the clarification, by the way.
Very welcome. You're very welcome.
Everyone knows we identify ethnically, or we identify with our group, but we know that as a coalition, it's important to be together under that one big umbrella, because then we're 23 million strong.
Exactly.
We're a large group. All right. So tell me your story, sir.
I grew up in Hawaii, and my father was in the U.S. Army, and so we basically traveled a lot. And we ended up landing in Seattle, near Seattle, Washington, up in the Northwest. And I attended medical school there at the University of Washington. And I came down to Los Angeles to do my residency because I did a combined residency in pediatrics and internal medicine. Around that time, I was trying to figure out what I wanted to do. And the reports first started to come out that there was a high diabetes prevalence in the Pacific. Yeah. There were some, and this came off of the back of some work that was done in the Asian American community in regards to increased prevalence of diabetes in Japanese Americans compared to Japanese living in Japan. And so I started to see all of these coming about, and then I think it was a natural progression for me to go into endocrinology. One of my mentors, when she was asked, why did she go into HIV oncology, she mentioned, what she responds is that she did it because all the people she admired were running towards the fire. So, they were people advocating for better healthcare. They were doing research. They were doing something to help the epidemic. I think that's why I was drawn to diabetes, is because the epidemic hits Asian populations, period. But specifically here in the U.S., we see pockets of a really high rise in chronic diseases. And this has a lot of play in what we're seeing now, is that there's an increased risk of dying from COVID-19 if you have these pre-existing conditions. So the fact that I started in chronic disease and now find myself advocating against an infectious process, it's not too surprising if you consider what we're dealing with.
Yeah, and the fact that, as you mentioned, if there are these underlying diseases like diabetes and high blood pressure and heart disease, this is what the virus loves to attack. It loves to attack these people who are beset with these things. And so it's you're seeing these things. All right. So now you are also, this is a firsthand thing. Not only you were a first responder right there in the front lines, but you also had the virus yourself.
Yeah, I towards the end of March, I started to have congestion and a headache, and I initially thought it could, because it's allergy season here in California, that's what I was dealing with. But I I knew that there was a possibility at that time, so I started to isolate myself in our home. But as the symptoms progressed, I realized that I was probably dealing with something more. So I had to physically leave the house, and I took about 2 weeks to recover. Um, and then I waited 2 weeks to be reassured that it was okay for me to come back. I had a negative swab um, before coming back home. And so, one of the interesting things was that, when I first heard about the high rates of chronic or COVID-19 infections in Pacific Islanders, part of me was a little annoyed, because, as I would flip through my phone to try to distract myself while I was in quarantine, every now and then I would come across like a picture of Pacific Islanders gathering. And so when the numbers came out, you immediately wanted to cast blame on these people. But, it took me about a couple minutes to realize that I was infected too,
Yeah.
that, and I was adhering to all the CDC guidelines. I was washing my hands, I was practicing social distancing, and I still contracted it. So it became more about, why are we predisposed? Why are we vulnerable? And yes, there is still room to try to improve our messaging to the community, to help reduce the behaviors that spread COVID-19.
Yeah, but
But it's much more than that.
well, while you were getting better, and I assumed it was because you were healthy. I mean, I assume you got it when you were working the front lines. Do you know?
I tried to social distance, and I really kept my going to the stores really low. So I can't say with 100% certainty, but the odds are that that's where my highest risks were.
At the
Was at work.
stores? Oh, at work, at work. Okay, so you were keeping social distance. You were doing everything that you were supposed to. You still got it, and probably at work. But now you're looking through your social media on your phone, and you're seeing all your community out there all together, socializing, not keeping social distance. And
Yeah.
were you thinking, how are they going to prevent it? They're going to get sick, right?
Well, I had to take a step back and realize that there's more going on than just that. And that although I was seeing it, those pictures were a lot fewer. Like it was not I think on any given day before the pandemic, I would have seen 10 times as many photos. But there's a level of mindfulness that's there. And I had to remind myself not to focus on, a few pictures, that there's more going on that we have to figure out to stop these numbers.
Right, like the underlying diseases and things like the eating habits and diet. Okay, so let's get to the headline. The headline is the rates of your community, the Pacific Islander community, is just incredible. And I hope we're not preventing you from seeing someone dying or
No, you're fine. You're fine. You're
somebody
fine.
with the need. All right. But the rates are incredible. 261.5 per 100,000 people in the population, which is almost double, right? 2.5 times of what it is normally with whites and with other groups.
Yeah. So, and the numbers are a lot higher if you comb down to different counties.
Uh-huh. So
Yeah.
this is
So
LA County.
yeah, if you go to where the biggest disparity is, it is really significant in LA County.
Hmm. And so the headline again, just to repeat it so that it sinks in, the rates for Pacific Islanders compared to other groups, 2.5 times. What do you tell people when you want to alarm them?
So in LA County, the rate of disease is about 12 times higher for Pacific Islanders than it is for the white population. But to put it in context, it's 7 times higher than our Hispanic brothers and sisters, and 5 times higher than our African American brothers and sisters. And so, it's these are numbers that are really concerning, and the death rates, they're not too far off of those disease rate risks. And so you have a very vulnerable community that's under fire here from COVID-19.
So when you see that the media, these people glom on to the African American stats, which are high, and they have a larger community, how do you feel when they don't necessarily overlook the Pacific Islanders, but they don't mention them and people don't think about them? How does it make you feel as a doctor from that community, covering that community, trying to help them? How does that make you feel?
Uh, you know, I think it's to be said that we're not in competition, that we're vulnerable communities regardless. And whether the media contributes to sort of this idea that, we're separate, the bottom line is that we are predisposed because we're in similar situations. Historical lack of access to economic resources and healthcare. Latinos and African Americans share that, just like Pacific Islanders. And so bringing light to their issue is eventually going to shed light on what turns the needle for us. Does that mean that we need to be a louder part of that conversation? Yes. I think there's a tendency to sort of try to separate people of color, to for good reason. You want to bring light to the issue, um, but I think some of the things that can help us, which we're trying to do in the community, those things would help other communities as well. Uh,
Yes. Go
yeah.
like, well, tell me, let's talk specifically though about your community, about why the numbers are so high, disproportionate to their representation in society. Is it that you mentioned, that in some things that I've seen you write, that a lot of the Pacific Islanders are essential workers. They're on the front lines like yourself.
Right. And so there are also essential workers that don't have a lot of means, and so I was fortunate. I'm very blessed to be in the station that I'm in. So, I think I was able to absorb some of the things that would have worsened my family's health, or the risk to my family's health. Um, you know, there's a lot, we're overrepresented in occupational categories like security, nursing home workers, food service. All of these carry high risk because there's a lot of contact with multiple people on any given day. And so when we talk about opening the states and not seeing any improvement in the protections to our essential workers, like personal protective equipment, hazard pay, free testing, all of those things will worsen if they're not available to essential workers, uh, will make our uh, the devastation that's happening in Pacific Island communities, that will just worsen when these states open without those protections.
Yeah, I mean, because you do mention in your writing that besides the essential worker part, disproportionate number of Pacific Islanders there. There's multi-generational families. They leave the work, they come home to these multi-generational families. You talk about the poverty rates, generally speaking, higher in the Pacific Islander community, so they can't afford the PPE to have some hanging around, or they may be using scarves. How significant are all those factors?
Oh, they're absolutely significant. Just like other populations, our highest risk group for mortality is our elderly. And you have an essential, but our highest percentage of infected is in that 30 to 40-year-old age group. And that's the essential workforce. And so trying to isolate family members in a house that's very crowded is difficult. Um, they're starting to be, and Asians probably can speak to this, which is why we stand by, we stand against, racially motivated violence towards Asian Americans brought on by COVID-19, because the stigma is real, and those families that are being afflicted, they may not seek help, and so what does that do? It causes them not to identify when they could possibly be tested and appropriately quarantined, and ask if they require services that will help them shelter at home more safely. Because stigma makes people isolate themselves, and isolation is how you make this virus increases transmission of COVID-19.
Yeah. So now you're part of this group. You're the lead, the Pacific Islander face on trying to rectify the situation, lower the numbers, educate the people. How do you intend to do that with your community?
So we have a very um, the strategy that we employ to try to deal with this pandemic is not one that we haphazardly put together. We combed every publication of what is being done in Taiwan, in South Korea, in Iceland, and now New Zealand, because these are all countries that have been successful in the war against COVID-19. And so we took those recommendations, including the 120-point plan that Taiwan published in the Journal of American Medical Association, and we separated them in categories. And based on those categories, we developed a strategy with things that are feasible for us to do here in the US. One of those is what you're alluding to, communication. How do we communicate better to our community in regards to health messaging? A lot of it has gotten out through social media. But we know that there are pockets of our community that are not responding. And a lot of it has to do with the fact that they are sort of in these wind tunnels, if you will, these echo chambers. And part of our trying to break into these clusters is to reach out to faith-based leaders and have faith-based leaders talk to faith-based leaders about reducing transmission, and how the responsibility of the wellness of our community lies on all our shoulders. And so we're activating faith-based rosters, because we may go to different churches, but we're all related, and you may not accept the messaging from a board certified physician through a social media piece, but you may listen to your second cousin once removed that reaches out to you, and so these are right,
In
right,
the churches, that's why you're going to the churches, right? You're going
exactly.
to get them where the community is.
Well, yeah, but and we're also being focused about how the community is getting their information. So we know that sometimes it's not the talking head. Sometimes it's through video. Sometimes it's through pointed infographics. And we're using all types of social media, including TikTok, which is not my wheelhouse, you
Yeah.
know. And
Norm,
so
yeah.
right, right. And so we're implementing all these different ways that our community communicates, because a lot of what we're talking about seems um, like the obstacles seem a little bit too high, such as we being a small community, it's difficult for public health approaches to reach us, such as, what you talked about, the difficulty of dispersing health information. Um, our community has been dealing this for decades now, and so these problems aren't new to us, which means that we have the most experience about navigating them. So our job isn't to try to replace these efforts by, federal, state, county, local efforts to combat COVID-19. Our job is to find the deficiencies in those and try to make them up with existing community resources.
Okay, that makes sense. But now, this is something you brought up when you talked about diabetes and heart disease, and
Yeah.
mentioned diet. And you're a doctor. I've recently certified in plant-based nutrition, just as a lay person, because I'd like to help the community. Filipinos have terrible levels of high blood pressure, heart disease, the whole
Oh,
thing.
yes.
We love our pork. We are people of pigment. We love our pig, and you're from Hawaii, so you know how much we love the Kahlua pig. So
Oh,
tell me, how do you get across to people? Because, all right, I'm just going to be frank here. A lot of people look at Samoans and look at Pacific Islanders, and it's like they accept the fact they are big people. They are body acceptance warriors. They know they're big. They eat big. Don't tell me what to do. Get out of my way. How do you defeat that, doctor? You're the doctor, the relatively skinny doctor, I might add. I don't know. I'm only seeing you on Zoom here.
right,
How
right.
do you fight that? How do you fight that?
Uh, so, I think there's a difference that people seldom recognize between body acceptance and health status acceptance. What we often try to laden our health messaging on is the optics of what health looks like. And so you have to be this thin, you have to be this, you have to look like this person, and you may not have any there may not be anything that relates you to that messaging. So one of the things that we're trying to do at the community level, and COVID-19 is actually helping with building that infrastructure, is this message of it's not about what you look like, it's about how you feel, you know. And yes, you're larger, but are you having trouble sleeping? Do you have sleep apnea? Do you have to inject insulin? You know, that's not body acceptance. That's accepting lower health standards. And so once you can tell people that this isn't about me judging you, this is about us agreeing that you deserve a better life. And from the community standpoint, our people, we speak in allegory. We speak it with storytelling. And the more our story is told that's in line with cultural values, um, you know, the more it sticks. Um, so we were actually trying to put together the exact thing you're talking about with summer schools for Pacific Islanders to learn their language, and in doing so, tie in health messaging. Because what we're noticing with the younger generation is they're extremely excited and interested to learn more about their culture, specifically being able to communicate in their native language. Um, they're not interested in health. So one of the things that we have to press upon as part of our teaching our culture is our culture has always there 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 are indigenous practices and values that speak to living healthier, and they are directly culturally related. And so we teach culture in a way that it is more about it's more about having them touch back to their cultural identity, um, instead of introducing a foreign concept of health and saying, hey, you have to follow this.
But can you see them ever accepting a whole food plant-based diet, or accepting a good vegetarian or maybe vegan diet that would lead them to health? Because as a doctor, and I know that doctors don't ordinarily get nutrition expertise or studies when they're in medical school. And the way that doctors treat medicine or medical care is that they go for the symptoms and then they deal with that. It's not really a holistic approach. But young doctors are trying to take that holistic approach, trying to use food. And is there a way, do you think, is it too far-fetched to think that some of our Asian communities would go to a whole food plant-based diet and try to fight disease with food? Because that food is really, and plants and vegetation, that's where that's where the real drugs come from, right?
Right, right.
Aspirin comes from trees. I mean, we can
That's
eat,
ac-
we can
that's
be,
actually a Pacific concept. That's
yeah,
that's a
exactly.
that's
Yeah.
a it's a traditional Pacific concept that everything heals comes from the earth.
Right.
Um, we have been divorced from that, with the introduction of the biomedical model, and so part of us trying to, because diabetes to me is a discordance between how we live and our environment, and so a lot of that realignment comes from touching back to a lot of these indigenous practices.
Right.
So um, a plant-based diet at face value is is kind of removing people from those indigenous practice entirely, but not fully, And so there's components of a plant-based diet that have they're very there are strong cultural rituals and values that speak to the plant-based part of our diet.
Right.
And then
Yeah.
but there's also there's also some that talks about healthier protein sources, like fish and chicken, if you will. And so, getting people to remember that this is that part of our cultural identity is tied into our DNA, takes a while.
Yeah. Well, it's true with all the Asian groups. I mean, the Chinese, traditional Chinese herbalists, Filipinos have their herbal traditions. And, but somehow you mix in the standard American diet, and
Right.
there it goes. The health goes to, and then you become susceptible to COVID-19, and that's why we're
Yeah.
seeing these high rates. Doctor, so the one thing you're going to do to try to like lower those rates and help your community, this
Get in, get involved. So the response strategy, like I said, is complex, but it's distinct, and so almost anybody that wants to participate can make a difference, and so whether it comes to tracking and testing, when it comes to safe resources, all of these require, calls and follow up. It requires an engaged community to help identify positive cases. And so there's multiple ways to get involved. Like one instance is the faith-based community has stepped up and has offered, if those quarantine facilities are at capacity, or if Pacific Island people don't feel um, confident enough to use those facilities, they've offered their community halls, which aren't being used right now, as temporary care facilities, to isolate people who are sick but don't meet criteria for hospitalization. And so these are all ways all of us can help. And like I said, I think the one thing we're realizing is that the strength of our communities is to show up for each other. And that's what's made COVID-19 so difficult, is we're used to showing up for each other physically. Um, Showing up for each other now looks like not going to church, but worshiping virtually. You know, it means helping families in need that are hungry to deliver food to them. It means pushing out any type of messaging or video that promotes these safer practices, you know, on TikTok, on Facebook, on Instagram. All of these is the new version of us showing up for ourselves, showing up for each other, because you know we this pandemic has ripped into our cultural fabric, you know, and we stand to lose more than just lives, you know, and so the coming together helps us keep the integrity of our cultural values while saving lives at the same time.
All right, one last question, and that is, California is opening up by the end of the week. More retail stores, beaches, some are closed, but some are open. 40 states opening up. A lot of people are going stir crazy, saying, "Get me out of here!" And you know, if especially those multi-generation Samoan families, you know, let me go. What, as a doctor, what do you tell them to convince them that, hey, take it slow, separate, social distance? This is sort of the more prudent way. What do you tell those people?
You know, I have to say that the community is responding. You know, we had a call today for a press conference and invited the community, and you know, it was, you know, now we do it as a virtual press conference, and unfortunately Zoom has like a 300 person capacity. So, you know, there was 300 people on the call with 100 people waiting. So the message is getting out there. And so I think people at least have the foundation to help protect themselves when the economy is open. Part of our trying to put together a strategy is that, you know, we see a second and a third wave coming. And unlike this first wave that's happening now, we're going to do our darndest to try to protect ourselves so that we don't see the same thing happen.
So you want people, I mean, your message, if some of the Samoans are out there and protesting the governor's office or saying, you know, give me my freedom, you're trying to say, what do you say to them?
I say protest for better leadership, you know, protest for safer conditions so that we can open the economy safely.
Dr. Samoa, I really appreciate your time. Where can
Thank
people
you.
go? Where can people go in your website and access the information?
So I'm not very good at social media, but I was told by my team to plug our websites or our social media sites. So the PI COVID-19 response team has a Facebook page. It can take you to the strategy for the response team. You can also...
What is that Facebook page?
PI COVID-19 response team.
Okay, on Facebook. Okay.
On Facebook, and it also has it'll show you how, if you want to get involved, there's links on there as well, and they have updated material as to what we're up to right now.
Okay, great. Dr. Samoa, thank you very much for joining us on Emil and Amok's Takeout, and I hope that Tua heals and
You're going to see a lot of Samoan Miami Dolphin fans next year.
No, I know that, you know, they love the St. Louis High quarterbacks are all.
Oh, you know, well, they followed what's his name from Oregon.
From Oregon, yeah, I forgot.
Mariota.
Yeah.
So they followed Mariota to Tennessee, and they're just going to keep following him wherever he goes.
Yeah.
So now now,
Here's Tua.
yeah, now Miami's gonna inherit the nation.
Well, I hope that I don't know. I don't know if they're going to be playing this year, but maybe
Right, right.
for the to keep the Samoans will have to stay by their television sets, socially distanced.
Oh, well, draft day is like a Samoan holiday.
Oh yeah,
So that was the one like shining sports moment during this whole epidemic.
right, right. Well, Dr. Samoa, thank you very much, and we'll talk to you
Thank
again
you.
soon. Thanks for joining us on
Oh,
Emil.
thanks for having me.
Oh, you're welcome. Take care.